So instinctual pushing. So when they tell you at the hospital, which is very common, either you're fully dilated and then they just tell you to push. Well, no, you got to honor the resting phase of labor. That's the most missed phase of labor. So when someone is completely dilated, that means there's no cervix around the baby's head. That that does not mean you need to start pushing. There's a time. There's that stage in between the end of labor, active labor, which you go from completely closed long cervix to no cervix, right above the baby's head. Then there's what we call labor down, or there's a time, it's called the resting phase, which varies in time, where mom might snooze, contractions or surges or waves slow down. And that's a time where it's good to take advantage of that snooze. And then it's just like the baby will the uterus, your body works, right? So it will gradually bring the baby down, just like when you poo, right? If you were pushing when you didn't have to make a bowel movement, you'd make yourself swollen and all kinds of problems, right? So when the baby gets down naturally to a point where you just have this instinctual urge to push your baby out, just like you have an instinctual urge to have a bowel movement, it's the same kind of like you just do it and you're pretty much done pretty quickly. So the baby comes down into the pelvis more naturally, and then you follow this instinctual urge to push, which is like working with your body. And so it's not like what they tell you at the hospital, okay, take a big deep breath and push and hold it for 10, 9, 8, 7, 10 seconds, and then take another deep breath, hold it again. That kind of coached pushing has, according to the evidence, is harmful, causes more fetal distress, more tearing. Okay, so if you can wait for that sort of instinctual urge, and then it's like little pushes that are more gentler and more in tune with your body, right? Your body, you're working with your body. It's like you can't help it.